I am so excited about today's conversation. I get the opportunity to talk to a dynamic woman, a woman who's had a wonderful opportunity to be a physician and to change so many lives, but now she's given herself the opportunity to make another decision and start something else. Mm-hmm. And so my very first question that I'm so curious about is, you could have kept going on this journey. Like, you were and are a successful physician, mm-hmm. but you've given yourself permission to start something new, and I am dying to know why.
Okay. So thank you so much, Jacqueline, for having me. This is such a good time for me and a good space for me. So I appreciate you for this moment. Why? Why did I start? Well, I became a doctor because I felt like it was a calling. I felt like, whatever spirituality people have, I felt like the Lord told me that this was where I should be. And I did it well. I did it well for almost... We're coming on 18, 19 years.
Oh, wow.
Yeah.
Okay.
Yeah. And a couple of years ago, I started to feel like there was more work for me to do in that mm-hmm. space. I didn't know what, though. I didn't know what, why, where. I didn't know where I was receiving this. Mm-hmm. But as I'm delivering babies and doing surgery and doing all these things, I realized that there was something more to this story. Mm-hmm. And you say, why now? I feel like it could have been 2 years ago. Mm. But it took time for me to develop that confidence to make that next step. Mm. And so that's where we are. I feel like it was a calling. I feel like turning the page and stopping and starting and doing that over again. And I'm in my 40s, and I don't mind saying I'm in my 40s. I feel like it's never too late, mm-hmm. Mm-hmm.
I've never asked you this question before, so this is totally an off-the-cuff one, but I'm curious. You could have been a physician in a lot of different fields and focuses, but yeah. Why did you land in the baby space?
Okay. That's a great question. So I like to explain things with stories. Mm. Okay, so when I was in medical school, I looked young, and everybody would say, oh, she looks like a pediatrician. Well, what does a pediatrician look like, right? And can I tell you, my pediatric rotation was awful. Mm. I got pink eye twice, got the flu, and I was like, this can't be my life. And so I started thinking about that. And then I did my OBGYN. Well, I was coming up with OBGYN. And I was like, I wonder if that's the thing for me. Mm. And the funny part is that you always have a piece of you that has fear. So I knew that with OBGYN, you would do surgery. Mm-hmm. So I'm like, can I do surgery? I mean, can I do it? I mean, I guess they would teach me, but I didn't know. Yeah. When I did OBGYN, it was the only rotation that I was happy to wake up for. Mm-hmm. I didn't mind reading late at night. Mm-hmm. And, as they would have it, our call room for medical students was right by the nursery, so we never slept because all the babies cried. I mean, they did that by design. Yeah. You know that.
No, I don't know that.
But I'm saying they would, because it's like a hazing situation, okay. Right? Oh, put the med school room by there. But that being said, it was something that I felt comfortable doing. Okay. And at the end of the day, I knew who my patients were. They were women, mm-hmm. right? I knew who was going to come through the door. I don't know what type of sickness this woman would have, but it was a woman that I was going to take care of. And that also was another twist, because when you're young, you kind of don't know what you want. Mm. You think the best. I mean, we were in our 20s. Yeah. Could you imagine yourself in your 20s? Remember?
No, okay. Not really. I mean, I do. My 20s were good.
Your 20s were good?
They were good. They were all right.
But, you have to make these monumental decisions mm-hmm. at such a young age. And for me, it was a natural progression. I knew about women. And at that time, I was young and bigger. So I'm like, okay, I could do surgery. Mm-hmm. I deliver babies. I could probably do primary care, because most times women only come see the OBGYN. Mm-hmm. So at that time, I was okay with dealing with blood pressure. I'm a little older now, and I feel like go to your primary care. But, so that was my lane.
Okay.
Being there, protecting women, treating women, and knowing that was my space.
Hmm. You talked about comfort a second ago, like it was comfortable for you. Yeah. And I want to talk about comfort a little bit more, because I understand most times when you want to give yourself permission to try something new, there's this level of discomfort that comes along with it. But we'll get there in a second. I know for sure that you are in the process of working on your MBA.
Yes.
Right? A huge, interesting twist and turn in your life.
Yes.
And that makes me wonder just your overall feeling about school. And I say that because I know you spend a lot of time in school becoming a physician. So this decision of yours to get an MBA, how comfortable were you with going down that path? Was it an easy choice or one that you hemmed and hawed and had to overthink and underthink? Like, what was that experience of giving yourself permission to go back to school after being in school for a long time?
Yes.
Right? What did that look like?
Story.
Okay.
Because you know I'm a story
Surprise.
person. Surprise. Let's just start with, like I said, a couple of years ago, I knew that there was some work that needed to be done. And sometimes your ego tells you that you got it all together.
Sure.
Right? Oh, yeah, I've been a doctor for this many years. I work in health equity. I know what the situation is. So I'm like, I can do it. But there was something that said, you need the credentials. Right? If I say, I'm Dr. King, well, what med school did you go to? Where did you do your residency? That's important. Well, I want to work in health equity and I want to learn about the business side of medicine. And, well, where you learn that? Where'd you go? And so I felt like going to school again after 20-something years. I graduated from medical school in 2004. So
just yesterday.
Just yesterday. What does it feels like? Knowing that, I said, I may not need the credentials to, I used to say this, I may not need the credentials to do the job, but I needed the credentials to get the job. I don't even believe that anymore. I got accepted to Yale School of Management, and I've only been in school since July, and I'm already
changing. This year?
Of this year.
Okay.
I'm already changing. My conversation is different. The things that I am learning is just incredible.
Has it changed your confidence level in how you see opportunities and how you're able to have conversations around business? Like, do you feel more confident?
Of course.
Okay.
I mean, and it's I posted on LinkedIn when I was never a LinkedIn fan, right? I am on LinkedIn now, and someone who I went to undergrad with as well as medical school with did this program years ago, and he wrote life-changing when he found it, and I was like, life-changing? I thought that was like,
come on.
Okay.
Right.
I did 2 weeks at Yale in July. I came home and even my husband was like, you sound different. And not about my pitch, but the things that are coming out of my mouth. So it's not just about, are you ready to start? Are you ready to do the work? And that's where that decision came from.
Yeah. When you started to tell me in our previous conversations just about your interest in the health equity space, I had interest in that just because of some of my previous work in discovering some of the best and brightest fintech and health tech companies. And health equity is just a huge part of my previous corporate life. It seems like lots of people are talking about health equity now, right? For you, why is health equity such an important conversation to have now? And truly, how big is the challenge that we have here as it relates to solving issues around health equity?
I think it's huge. Okay. We're talking about health equity. I don't think a lot of times people even understand what that means, or is it a big deal or whatever. So one of the questions you asked is, why is it important?
Particularly now.
So I don't know if you know or if you've heard that Black women are dying in childbirth 3 to 4 times more than white women. I don't know if you heard that.
I have heard it because you told me.
I told you.
Yes.
To me, and right now I'm getting goosebumps and even just talking about this, so just bear with me. I am on the front lines of that. I've seen it. And so for me in my work, health equity is huge, right? Because we're talking about Black women, your sister, your aunt, your cousin dying. I mean, didn't have to. Black babies. We don't talk about that as much. I mean, I'm not a pediatrician, but the prematurity rate or black babies dying, all of this is important, and it's not in the mainstream. You know, we talk about other things that people talk about in terms of the opioid crisis, or we need a maternal crisis because that's what it is. So when we talk about how do we dispel it and how big is it, It's big because it's so multifaceted.
Mm-hmm. Mm-hmm.
So a question could be, well, what causes that? I mean, why does that happen? When we talk about something called the social determinants of health,
Mm-hmm.
what is that?
Mm-hmm.
Lack of access,
Where you live.
where you live, and let's just call it what it is, racism.
Mm-hmm.
No one likes to say it. They have a new word for that, and I don't know if you know it.
Mm-hmm.
It's called the unconscious bias.
Mm-hmm.
That means racism.
Yeah.
And we need to be clear about what we're talking about. We talk about how patients are viewed. We know Black women are unheard. We are pushed away. We are silenced. Our pain is not really that important. We have more pain than anybody else. I don't know how, genetically, we have more pain. So when we talk about those things, we need to start talking about how do we fix those things.
Mm-hmm.
And that is my passion now. I've been on the front line. I'm in the game. And that's when that calling came to say, well, Dara, you need to do a little bit more.
Mm-hmm.
You're comfortable. You get a check every 2 weeks.
Yeah.
You're delivering them babies. You're doing them surgeries.
Feels good.
Feels good.
Yeah.
You're Dr. King.
Mm-hmm.
Which that's another story.
I know.
Dr. King, right?
No ego problem with that.
No
right?
ego problem with that. But what are you doing to really make a difference globally?
Yeah.
On a larger scale.
Mm. I want to get into a conversation around just the mental space and the mental permission that you had to give yourself to start this thing.
Okay.
And we're going to do that right when we come back from break.
Okay.
Is that cool?
That's awesome.
All right. Awesome. So what a wonderful first half of our conversation.
Yes.
Where we talked a bit about how you gave yourself permission, how you gave yourself permission to be a physician, but more importantly, I'll say how you gave yourself permission to start something new. And we also talked about your commitment to the health equity space overall. I'm just dying to know, right? Since it sounds like you are a woman who likes order, right?
Yeah.
You like step 1, step 2, step 3.
Indeed.
You don't want to skip to step 26. You want to go step 1, 2, 3, 4, 5, right?
You know me so well.
You know. I'm curious about how hard or how deep you had to dig to give yourself permission to even consider starting something new. Of course, as we talked about, you've been a physician for almost 2 decades now, all right? And you had to give yourself permission to start your MBA, right? How difficult was this decision of yours to switch gears after doing something and being so successful in something for so long to start something new?
I think that's a loaded question.
Okay.
Okay. I know you don't care. It was difficult, but not so much. And I know that seems kind of controversial because it's both sides of the coin. I'm a woman of faith.
Okay.
And throughout my whole entire life, my entire career, I have had steps that were ordered. Now, I'm a little hard-headed sometimes because I'm so structured. And I, like you said, step 1, step 2, step 3. When I got the calling to be a physician, I made a deal with God. I'm like, okay, if this is what you want me to do, I'll do it. But it's going to be easy, right? Like, that's what I thought, right? Because it's of God, and this is what He wants you to do. And He positioned me, and it was not. So I didn't make any more deals like that. Just so you know. So when I was called to to go back to school and to do this work, I stepwise did it. I took 1 step at a time. I had a great support from my family. My husband, honestly, is my biggest cheerleader. Well, Mary Morant, my mother, is the biggest one. So let's let her on record.
Right.
Mary
I was
Morant.
about to say, she just realized her mom was going to watch this.
And that's the truth. Mary Morant is number 1, but Tracy is a close second. And when I found out about the program at Yale School of Management, I was getting my nails done. I'm just LinkedIn. I'm scrolling through LinkedIn. I'm getting my nails done. And I see this capstone project by one of their students who was doing equity work in infant mortality in the Black community. So I'm like, wow, there's a class for this? They do a whole training? So to go back, that's how it kind of started. So I text my husband and my sister, who, if Mary and Tracy are 1 and 2, my sister is in between them.
Okay.
As my cheerleader. And my sister, quite honestly, is the smartest person I know in this world. And she's getting her PhD. That's just like, she's just a lifelong learner.
Yeah.
So I text them too, getting my nails, one dry, the other one on the other phone. And I said, are we doing this? And it was just that random. I sent them the article, and I won't use the words verbatim, but they both said yes. And I needed them on board, because when you are going through life and whatever, you need a network. You need a support system. As we talked about earlier, I'm a transplant. Yeah. I'm here in Maryland. I'm from Detroit, Michigan.
Go Detroit.
Go Detroit. And
we kept it real PC there.
We did.
We wanted to be a lot more extra than that.
Yeah, we did. We can do that later. Offline.
Exactly.
But when you are going through something, you need a network of people. And if my husband, who is my rock, was not on board with me, I could not have gotten started. And my sister, who, again, smartest person I know, she's in grad school plus, she walked that walk with me, and I was able to make that decision. And so when I say it was difficult and not so difficult, it wasn't difficult saying yes, but maybe walking that walk was a little bit more work than I kind of expected.
Yeah. It's nice to hear that you've started, and it's nice how inspiring it's going to be to other people. But I have to ask, and you have to be honest in saying, were there any false starts? Were there stalls? Were there like, ooh, I started down this path and yay, and feels good, but wait a minute, I'm stuck and I'm scared. Tell me about that journey, or tell me about that process, or what that may have even looked like for you.
I just feel like in life, there's a lot of false starts, right? I'm a dancer. I used to do formal ballet, and I remember that 5, 6, 7, 8, but you don't start right away, right? And then you get in trouble because you weren't on cue. Or the 5, 6, and you excited, you ready to go.
You still remember this?
Oh, I do.
Very well.
Oh, very well. The 5, 6, you're ready to go, and you get a step early. Or they talk about false start in football. My husband makes analogies to football. So I think that's a life lesson. Yeah. So yes, last year I was ready. Right? I have something called Girl Talk with Dr. King. And we're going to talk about that a little bit more. And that's a part of my health education firm, because I do believe that part of this health equity and tearing down these gaps is education. So we'll talk about that. But I was ready. Last year, I was poised. I had my lecture series, because I'm a planner, right? Right? We had advertised, and I was ready to hit that button. And it was basically pulled from underneath me.
Tell me about that.
I was in a situation where it could have been considered maybe a conflict of interest.
Okay.
And I wanted to honor my contract, because I am a rule follower. I need you to understand that. And so in honoring that contract, I couldn't move forward in my personal space. But my personal space was not so personal. It was really public. It was global. I wanted to make a difference. And so the launch for Girl Talk was supposed to be September 2021. We are now October 2022, and it's even better.
It is. And you're still going.
And I'm still going. And so sometimes the Lord will say, He won't say no. He will say not now.
We're going to talk about Girl Talk in just a second, because I want to make sure that people know more about what it is and what they can expect from it. Yeah. But as I hear you talking about the health equity firm and challenges that women have had in different spaces of their life from a medical capacity, I can't help but think about the A word. I've had a friend that recently wrote a book about pushing back and speaking up for yourself. And I look forward to a book that I'm sure you'll write in the future as well. Okay. But I can't help but think about just advocacy. Yeah. And how you have to advocate for yourself. Yeah. And for so many people that are watching and listening and trying to think like, well, how do I do that? Like in a medical capacity, like how do I even advocate for myself? Yeah. Like, how do you do that?
Okay. Have a story, because I'm a storyteller. So during COVID, I was on a medication that I wasn't sure should I be taking during COVID, blah, blah, blah. So at the previous health institution I was a part of, I reached out to my doctor via email. And when you email, the picture of you come up, right? So this particular doctor knew that I was a Black woman, fine. And so I said, hey, doc, you know, I stopped taking such and such. Do you think it's now a good time to get started with it? And very abruptly, he responded days later, responded back like, I never told you to stop taking it. Why did you stop taking it? And you knew the tone in the text. And so I was like, whoa. So I responded back. I said, well, I'm a physician and I work with COVID patients every day, and I was a little bit concerned. And the tone changed. Oh, I didn't know you were a colleague. But, and went on and explained a whole list of things. So, it should not have changed because I said I'm a colleague.
Absolutely.
I'm Dr. King. I never signed my name back. To you, I'm Dara. You don't know any different. So, self-advocacy is important. But if you don't know the right questions to ask, how can you advocate for yourself? I was raised in a home. My mother, we were low socioeconomic. You would have never known. Not with Mary Moran. But we were. But that did not define who we were or what we said. So we would go to the doctor. We went to the dentist every 6 months, and she had a list of questions. My sister was a little bit more sickly, and she taught me that. But everyone's not taught that in the home. So in transitioning to Girl Talk, that's my goal. When I have these lectures, it's going to be a 7-lecture series where we talk about different stuff. Vaginitis, fibroids, abnormal bleeding.
Ooh, all things I'm shuddering about.
Menopause. You may not know what to ask your doctor. But if you say, I saw that little 7-minute video, or no, because you know, young people don't like a whole lot of talking.
Right.
But if you say, I saw that video on such and such or on Instagram, and the doctor said something about yellow discharge isn't normal. Sometimes you don't even know that. And again, by that physician, I was dismissed. I was unheard. And basically ridiculed or something that I did not know. I'm a physician, but I don't know everything about everything.
Right.
Which is why I go to you. So that's something that is important to me in this health equity space, is learning how to be an advocate for yourself.
And I'm very much looking forward to the impact of Girl Talk. I'm looking for the formal relaunch and impact that Girl Talk will not just have in my life, right? I'm a woman who, and you know, every woman that's listening, or actually every man who's listening who's an advocate for a woman, we're aging, right?
Yeah.
And your body's changing over time.
Absolutely.
And so I'm looking forward to the conversations within Girl Talk, but I'm also looking forward to your platform giving other women permission to have conversations just like this, right? And so I'm curious, are there going to be spaces where you're going to have other intimate conversations or conversations sort of similar like this where people can get involved and hear more about your message?
Absolutely. When you go to my website, it says conversations women want and conversations girls need, right? Again, Mary Moran, bring her back. My mother was very open to us. She was a single parent. Dad was around, but dad was not in the home. So single parent that was very open to us. You know, I had to talk twice, right? Because I have an older sister, so I got it with her. Then I got it by myself. And then she double checked again.
You got it 2.5 times.
But it was okay.
Sure.
I had that space. But everyone's not having that conversation at home. She used to say, well, I can't quote her because we're online, but she used to give me money when I would go on a date and say, if he ever say whatever, you have your own money, you could get home, right? We didn't have cell phones back then and all of that kind of stuff. So I had a mother who drove that into us. Ask questions, this is this, this is that. And my mother used to say, I have to tell you this.
Sure.
She says it's all about the presentation. My mother would say, if you present it like filet mignon, it's filet mignon. If you present it like garbage, it's garbage. And that I say that with my kids. So having these conversations, to me, is not taboo. I mean, people tell me any and everything, sometimes too much. And I just let them, because they don't have a safe space.
Absolutely. And
I'm so non-judgmental, and it's just, you need to get it out. So I do look forward later to having open forums. I kind of see it as just a space for free talk. And still allowing people to be anonymous. Like I used to have a teen group where we would have I'm an AKA, and we would have AKA teens, and we would have a weekend. And this kind of started with my group, and we would let them ask whatever, but they would put questions in a bucket. And they could go around, and no one put their name on it, and we would there would be maybe about 4 or 5 adults. And we would just answer these questions as honest as we could for young people to feel like they had a space to be heard.
Isn't it so interesting, though, like in that format with young people and you creating the safe space for them to ask what they want, how we become very accomplished and smart and valuable women over time, but we still have to create these spaces to get these questions answered because, you know, even if I would just throw myself out here for a second, I just turned 40. And I feel like every couple weeks, like my body's doing something new that I'm just like, wait a minute, like what is that? Like I've never experienced that before. What is this mood? I'm a positive person, right? And so I appreciate these conversations because I've never been here before. And I'm looking for someone who is several steps ahead of me, right? Smarter than me, who's an expert in their space and cares, right? That I can come to with these questions to make sure that I don't think that I'm dying because, you know, I'm tired, right? I'm more tired than I was, or my mood's a little bit, you know, crazier. And so with that, I'm very grateful, and I look forward to the conversations that you will make people comfortable with having, and the spaces that you'll create in doing so. I'm proud of your journey. I'm excited for your journey, but I can't help but wonder, what is next? Like, what's next for you? What are you excited about, and what can we look forward to?
Okay, so I'm super excited about school.
Who says I'm excited about school other than Dr. Darkin?
It has been, as to quote my colleague, it has been life-changing. So school has been amazing. So once we get through that, right? It's 22 months. I'm excited about bringing Girl Talk to bring it to life. You know, we've been talking about it for a long time. We know it's what we need, but that is what gets me going in the morning and night and our conversations. There are other things that's in the horizon, and I already know where you're going with that, but we don't know. I'll keep it there. Between school,
I know, but no.
You know, but between school and Girl Talk, and I still am a OBGYN. So I still deliver babies. I'm still working full time. So my program is an executive MBA. So I can work full time. I can still do school. I have a whole family. So trying to juggle it all. And that's the other example that I want to set, is that you can have it all. It's how you define having it all is, right? I'm not 100% in everything, and I have a good support system, and I have to take breaks, and I have a lot of help. You have been such a huge support to me in this journey, and starting, and I don't want to say starting over, because I'm just starting something different. And you can have what it is that you want to have, and I don't want anyone to ever feel like they're limited in what they want to do.
I'm excited, not only, of course, for the health equity firm, but I am incredibly excited about the permission that this conversation will give other people to start the things that they want to do. And I also hope that something that people glean from this conversation is understanding that the experiences that you've had can just serve as the foundation for the things that you want to do in the future. Like so many of us have careers for 5, 10, 20, 30 years, or we'll think, let me do something else. And we'll decide to, or think that they have to throw that previous experience in the trash. No, we're leveraging that. You're utilizing the experience that you had to start the things that you truly want to do.
Sure. We're building on a foundation.
Absolutely. And whatever the foundation was, it doesn't matter if you're going from being an artist to an engineer to a chef. There's some foundation that you have to build. From going from an OBGYN to a global health equity firm and beyond, right?
Yes.
There's a foundation that you build and then you elevate. Well, I want to say thank you for spending some time with me.
Yes.
I appreciate you. I'm looking forward to how you're going to impact and change the world, and I'm hoping that we'll have another conversation in the future.
Thank you so much for having me. It has been an amazing journey with you, and I look forward to continuing to work with you.
Absolutely. Well, thank you, ma'am.
Thank you.